if the public option passes and the president signs it, I certainly think that we should take part, as long as it doesn't result in higher taxes for Virginians and is revenue neutral.
So if it got to the point where a public option was passed by the federal government that met all the criteria that you were talking about, but then a potential governor deemed it to not be appropriate for Virginia, and there was a legislative battle that you could potentially be a part of with the Senate as close as it is right now, would you vote to keep the public option in Virginia, or would you side with then Governor Deeds?
Well, Ryan, let me be clear. I haven't had an opportunity to talk to Cree about this, but knowing his values and knowing how much he wants to see health insurance available to everybody, I can't imagine that he wouldn't be in favor of the public option in that case. Well, let me say this. I haven't seen a bill that I can review and say this is what the public option means.
Mm-hmm.
So, asking me to say I categorically under all circumstances would support it is tough, because it depends whether it's going to cost Virginia taxpayers more, whether it's affordable for the state, whether it accomplishes the goals of increasing access. It's sort of theoretical. It's very different than the position of our opponents, which are outright, without considering the public option, are just denying it and saying that they wouldn't consider it. I can't speak for Bob McDonald's motives, but I can tell you that Bill Bowling is a health insurance executive, and he comes at this entirely differently than I do. He comes at it from the standpoint of protecting insurance companies. He spent his legislative career doing that. If you look at his Senate votes, he voted against the Patient's Bill of Rights, which meant voting against requiring coverage of pre-existing conditions, against requiring access to a specialist, against allowing somebody that's very ill to have a specialist as their primary care physician, and against being able to sue an insurance company if their negligence cost harm to a patient. So, his perspective is very clear to understand, and it is totally different than mine, where I think that we need to worry about patients, and we need to put patients in the driver's seats for their health care, not insurance companies.